I had an experience going to the hospital when the coronavirus thing happened, where they put me in isolation and they wouldn't come in unless they absolutely had to. And then it was about 4 hours before anybody else came in, and I was going nuts. I wanted to go home.
I am Max Barrows. I live in Worcester, Vermont. Because of COVID-19 or the coronavirus, there are big changes in how hospitals and doctors work. They are not letting people visit patients. There are two reasons why. Number one, hospitals are worried that visitors can catch COVID-19. Number two, visitors who have COVID-19 can give it to other people. Some people who have COVID-19 do not show it. They may not even know that they are sick. The new rules about no visitors can be a problem for people with disabilities. Often, we cannot go to the hospital or doctor's office alone. People with disabilities may need help to communicate and understand what a doctor or nurse is saying. Here is the good news. If you need help in the hospital, you may be able to bring in a person to help you. And that can happen even if the hospital has rules that says no visitors allowed. I will explain how to advocate to bring a supporter with you when you go to the hospital or doctor's office. First, some background information. People with disabilities have rights. There are two laws that protect our rights. When we know the laws, we have a better chance to get what we need. The first law is the ADA. This means the Americans with Disabilities Act. It protects people with disabilities. The second law is Section 504 of the Rehabilitation Act. It says any program that gets federal money must give people with disabilities equal opportunity and equal access. Both laws require hospitals and doctors' offices to make reasonable accommodations for people with disabilities. This means that sometimes they have to change rules for people with disabilities. For example, many hospitals do not let dogs in the hospital, but they have to let service dogs in the hospital. Okay, if you need a supporter with you when you're in the hospital, here is what you can do. Step 1. You should first tell the hospital you have a disability. Then tell them you need a patient support person with you when you are in the hospital. Make sure to say that the supporter is a reasonable accommodation under the Americans with Disabilities Act. Step 2. Explain why you need a supporter to get good health care. For example, to help you communicate. You may need someone who understands the way you express yourself. You may need help using a communication device. To help you with personal care. Some people need a supporter who knows how to safely assist them to eat, go to the bathroom, and take a shower. To help make decisions. When making decisions, some people need help understanding what choices they have. To help you talk to doctors. Doctors talk about things that are hard to understand but are important to your health. Some people get supporters that help them understand what their doctor is saying. To help you feel safe. Some people cannot feel safe unless the right person is with them. Some people, when they do not feel safe, panic. People who panic cannot breathe as well, or they might try to run away. That is also not safe. This is why some people might need the right person to be with them. Step 3. Describe why you need a supporter to be with you in person. Sometimes you may be able to get help by calling your supporter on the phone, but sometimes you need someone there in person. Explain why calling them on the phone will not work. Step 4. Say how your supporter will be safe when they are with you in the hospital. For example, your supporter will agree to wear a mask and gloves. They will wash their hands a lot. They will stay far away from people other than you. Okay, I have a few final tips. If you have trouble speaking, you do all of these steps with your supporter. Also, you could try putting all this information on a form. Look for a link to a sample form in our YouTube description. Remember, hospitals have to follow the Americans with Disabilities Act. For more information on the Americans with Disabilities Act, check out the website ada.gov. I recommend showing the hospital rules that apply to them. And finally, call your PNA. There is a protection and advocacy organization in every state. They help people with disabilities understand their rights and help fight for their rights. The National Disability Rights Network has a list of PNAs in every state. You can find the PNA in your state by going to the www.ndrn.org. I want to end this video by sharing some great news. On June 9th, 2020, the Office of Civil Rights made it clear that all hospitals must allow any patients with disabilities to have a support person with them. Here are 7 details about what the Office of Civil Rights said on June 9th of 2020. Number 1, all hospitals and doctors' offices must allow people with disabilities to bring someone with them. Number 2, hospitals must provide personal protective equipment, PPE, for your supporters to keep them safe. When we say PPE, we mean a mask or gloves or goggles or a gown. Number 3, you can have more than one supporter help you out when you're in the hospital, but your supporters must take turns being with you. You may only be allowed to have one supporter with you at a time. Number 4, your supporter can leave the hospital to take a break and come back later. Number 5, people with all different types of disabilities are allowed to have a supporter with them in the hospital or a doctor's office. Number 6, your support person is allowed to eat, drink, and use the bathroom while they are in the hospital. Number 7, the medical staff must write down how to best communicate with you. Communication with people with disabilities needs to be as equally effective as communication with people without disabilities. That is how we can have equal access and equal opportunity. I just want to emphasize that it is for all states, and if you want to see it in writing, look for the link with this YouTube video. Good luck and stay safe. Thank you, and good luck speaking up for your rights.